Hi, my name is Ollie. In 2019, when I was 7, I found a bump on my neck that turned out to be anaplastic large cell lymphoma ALK positive. Over the next year, I relapsed multiple times and lost my sight at the age of 8. During my cancer journey, the treatment took me from CHEO in Ottawa to Sick Kids in Toronto, where I had my stem cell transplant. Now, at the age of 14, I realized that the medicine that kept me going was the fun we had during the battle. Play isn't just a distraction, it's also part of the cure.
Lesson 1. Give the power back.
In hospital, you lose your power. To help us, give some of it back. At CHEO, my nurse wrote Team Ollie on her PPE the day I started chemo. Suddenly, I wasn't just a patient, I was a partner. I learned to advocate for myself early, asking for procedures sooner so I wasn't hangry, or asking for help to find my missing lung. From letting me choose my own superhero for my radiation mask, to letting me take my own vitals while blind, those small wins built trust. Once when I had a fever, during the first COVID outbreak in hospital, my ER team gave me a 24-hour antibiotic and sent me back to my condo because they trusted me as a teammate. The lesson: invite kids into the process. Make us patient partners.
Lesson 2. Bringing the outside in. I am a big fan of board games, video games, and sports. Having board games and video games in hospital that I also played at home made things feel more normal. And if they didn't have it, they worked miracles to get it for me. I also miss sports and being on the rink, so Child Life helped me bring the rink to the ward. We used a simple white bedsheet to create an arena in the hallway and had epic mini-stick hockey games. I even got doctors and patients to play. Those games turned the hallway into a community. Think outside the room and treat us like teammates. A mini-stick and a bedsheet can turn a scary space into a fun one. Lesson 3. Sensory connection and passion projects. I was always a kid who needed hands-on play, and touch was always a part of how I learned. And then when I lost my sight, I really needed tactile ways to play. In hospital, music therapy was my favorite. I had a blast learning about and trying so many different instruments. Music therapy was really the highlight of my transplant. Since then, I've been taking guitar lessons and want to become a music therapist myself someday. Collecting spinning tops is one of my passions. There's nothing like having epic battles with them. People always asked me about Beyblades when they were in my room, and some even took the time to battle me. Therapeutic clowns always made me laugh and made any situation better. Ayla Boo would bring Beyblades and pretend he didn't know how they worked, which gave me the chance to be the expert and teach him how to battle. Use a child's hobbies and let us be experts. It gives us back some of our power that cancer can't take away. Conclusion: treatment to triumph. Abby has taken her role as my big sister seriously since the day I was born. In July of 2020, I got my stem cell transplant using her cells. She is one of the many heroes in this story and has given me a second chance at life. We were grateful to work with the palliative care teams and had so many amazing supports. My transplant seemed way easier than earlier treatments because we asked for more support and got more fun. But some families won't ask for more support, so we should be offering more help. I'm 14 now, and I'm proof that a bump in the road is just a bump. We celebrate my rebirthday and Abby's Hero Day each year now, and we'll always be grateful that we get to finish growing up together. To my medical team, thank you for playing hockey with me, for listening to my music, and for trying to make things more accessible for me. And most of all, thank you for seeing the kid behind the diagnosis. You aren't just curing a disease, you're healing our spirits with fun and helping us turn treatment into triumph.